Hi, I'm dentist Muhammet Kocak. I am a periodontist based in Sivas, and today I want to discuss gum recession. I perform many procedures to correct gum recession and treat it. A lot of people are interested in understanding what they can do to prevent or reduce gum recession, so let's cover some strategies. 1. Toothbrushing techniques. First, let's talk about brushing your teeth. In my opinion, using a manual toothbrush is preferable to an electric toothbrush. I believe it offers better control and is less likely to damage the gum tissue compared to an electric brush. When using a manual toothbrush, do not grip it with your fist, as that may lead to aggressive scrubbing. Instead, hold it lightly with your fingertips and brush carefully and gently. Brush downward on the upper teeth and upward on the lower teeth, rather than brushing back and forth, which can contribute to gum recession. Additionally, use a soft bristled toothbrush. This is an example of a soft toothbrush, and there are also ultra-soft toothbrushes available. While these may be a bit pricier, the bristles are incredibly soft. I have used them myself, and even though they may not feel as effective, they do an excellent job of cleaning. If you decide to use an electric toothbrush, hold it between your fingertips to avoid applying excessive pressure. Although I recommend manual brushes due to their controllability, electric brushes can work if used gently. 2 effects of smoking and vaping. Other factors that can lead to gum recession include smoking or vaping. When you smoke or vape, you expose your gum tissue to nicotine. Nicotine causes the blood vessels supplying the gums to constrict. When the gum tissue doesn't receive sufficient blood flow, it is far more likely to recede due to inadequate nourishment. Therefore, if you're worried about gum recession, avoid smoking and vaping. 3. Progression of gum recession. Once gum recession begins, it generally tends to worsen over time. While you can take steps to slow down its advancement, it will typically progress unless intervention occurs. Here in our practice, we work to build up gum tissue, make it thicker, and cover exposed roots. These actions help to halt or slow down the recession process. When the gums recede, the underlying bone recedes along with them, making it crucial to protect the gum tissue to avoid bone loss. 4. Maintaining oral hygiene. To minimize gum recession, it's essential to keep your teeth clean, especially between them. This means either flossing or using interdental stimulators, which I actually prefer over traditional flossing. 5. Orthodontic treatment and gum recession. Let's also discuss orthodontics or braces. Orthodontic treatments are often necessary, but a significant number of patients with gum recession have had braces in the past. Recession can sometimes occur years after orthodontic treatment ends, whether that's 1, 5, 10, or even 20 years later. It appears that the gum tissue becomes more prone to recession following orthodontic work. 6. Preventing and addressing gum recession. To reduce your risk of gum recession, be gentle with your gum tissue. If you already have gum recession, follow these tips to slow its progression. If the condition is severe or continues to worsen, feel free to contact us. We specialize in pinhole treatment for gum recession, which helps prevent bone loss, protects gum tissue, and covers exposed roots. Maintaining a healthy mouth contributes to overall health. Have a wonderful day and work on restoring both your smile and your well-being. Let us know your gum ailments in the comments. This video has been reviewed and produced by me, Health Guide YouTube channel Health Counselor. Follow the Health Guide for more information. Dentist Muhammet Kocak. Live well, age strong. Your guide to a healthier, happier you. Health Guide.